Hello and welcome to scenario 14 of the AKT Podcast. In this scenario, I will share a very typical ENT presentation followed by 3 AKT questions. So a 40-year-old patient is complaining of a 3-week history of dizziness. Each episode of dizziness lasts around 30 seconds and he finds that it often occurs when he turns over in bed or he leans to pick something up from the floor. The patient has no hearing loss and no tinnitus. Question 1. What is the diagnostic investigation for this patient? Question 2. What would be the first line treatment to offer this patient? Question 3. How could the patient rehabilitate themselves at home? So feel free to pause this and have a think about the answers. So this is a really typical presentation of benign paroxysmal positional vertigo, BPPV. From the scenario itself, the fact that the patient has symptoms which occur on bending and turning, and that the episodes last for less than 1 minute definitely supports the BPPV diagnosis. The diagnostic investigation for BPPV is the Dix-Hallpike maneuver. This should trigger vertigo and nystagmus in the affected patient. Now, BPPV is a condition affecting our labyrinth, and crystals of calcium can actually become dislodged from their normal position, which is actually what triggers the spells of dizziness. Now, the treatment is therefore to reposition those crystals, and this can be done in primary care if the relevant expertise are present. So the first line option is the Epley maneuver, and the Epley maneuver, typically speaking, symptoms settle within 1 to 2 weeks, but it can take up to 4 weeks. Now, if the patient remains particularly symptomatic after the first week, it can be repeated. But if the patient is still symptomatic at 4 weeks, then really the diagnosis should be reconsidered. Now, an alternative maneuver to Epley is the Sermont maneuver. And finally, for some patients, it's not appropriate to do the Epley maneuver. And this, one of the circumstances of that may be that the GP in itself is not confident in providing that treatment. So in this scenario, it's very appropriate for the patient to consider something called Brandt and Daroff exercises, which can help rehabilitate the patient at home whilst they await a secondary care referral. I hope you found this pod helpful. The aim of this pod was really to highlight how you can prepare for multiple questions within a single scenario, and that's how you should really use the AKT question banks. Again, this is a really helpful way of utilizing those questions within the banks and trying to get them as close to what may be present within the AKT itself. I hope you found this pod helpful. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.